Hi, Jason Champion Fitness Science. I'm just going to demonstrate 3 active hip releases for 3 different muscles around your hips that can get bound up if you sit a lot, which can obviously disable your range of motion through your hips, but it can also disable your core's ability to stabilize your lumbar and pelvis and can lead to some back pain as well. So the first one is for rectus femoris. It's the big quadricep muscle that runs down the middle, and the trigger point for that is 2 inches below your ASIS. Those are the pointy bones that stick out from your pelvis in the front. So if you go about 2 inches below that, 2 to 3 inches, immediately below that towards your kneecap, you're going to find a point where if you lay on a ball, it's going to give you a little bit of discomfort, even a little bit of pain. Once you find that spot, and you can roll up or down just a little bit to find the most significantly discomfortable or uncomfortable spot, you're going to flex and extend at the knee by bringing your heel towards your backside. And as you do that, you're going to try to press in just a little bit more and give yourself a bit more pressure. And that's going to amplify that discomfort a bit. But after 5 or 6 of those, and probably no more than that, you can stop and you should feel a little bit looser through your hips from doing that. The second one is for gluteus medius. So if we go to the back of our pelvis, the PSIS, posterior superior iliac spine, our landmarks to start with there. And then if you go 1.5 inches to 2 inches directly lateral, directly outside of that, that's the center of gluteus medius or thereabouts, and that's the muscle that we're going to try to release for this one. So you're going to get into a position kind of like you're at the top of a sit-up, and then lean back on your elbows, and then just kind of roll to your side onto the ball. Now the movement to actively release gluteus medius for this release is either hip flexion or extension, so bringing the knee towards your chest and back down, and again that's going to amplify the zing back there, or an external rotation is another option, where you can combine the two and just do a bit of a half circle with the knee. And again, just 4 to 6 of those on each side is going to be sufficient while holding in the spot that you're getting the greatest discomfort. The third one is for TFL or tensor fasciae lata, which is a small muscle that runs into the IT band, which is the band that runs all the way down the outside of our thigh. And that's pretty much like a cable, so you don't want to roll that. You see a lot of people rolling that directly, but if you release the muscles that run into it, which are glute max, probably don't want to release that. You want that active. But TFL is the other one at the front. So again, you find that ASIS point, and just below and a little bit to the outside of that, so not on the very outside of your hip, but kind of the front outside is where you want to target with the ball. So lying on your side is the best way to access that point, and then you're not going to go right on your side, but you're going to roll a little bit forward onto that ball, and you'll know when you're on it. Then you're going to want to create space with that top leg by creating a bridge where you can move your releasing leg through, and then you're just going to bring that, again, hip through flexion and extension while you're on that release point on the ball, again 4 to 6 times. Doing those 3 releases on left and right side, or if you have a little bit more tightness on one side or the other, you could do a bit more on that side. Is going to again help give your hips greater mobility, improve your function through your hips, and improve your core's ability to stabilize your low back and pelvis, and hopefully help you manage any back pain or discomfort that you're having from sitting down all day. Thanks.